Hello everyone and welcome. I'm sorry that I made you wait a few minutes. We are still having troubles a bit with getting Thierry online, but until that moment we hope we can get him connected to this webinar. Just before we start, I would like to share with you a bit of information. The session is being recorded and it will be made available to all of you after this webinar. Tomorrow is Friday, but for sure next week, Monday, you will receive an email with the recording where you could watch the recording of this webinar and the slides of where you could download the slides of this webinar. I'm happy to present to you this together with Thierry Bonnaud from Veranova, this webinar on control crystallization and crystallization inhibition, standard and novel applications of the crystal 16. Okay, if you have any questions during the webinar, please feel free to write to us in the chat option of this webinar, or just send us an email afterwards at info@crystallizationsystems.com, and we will do our best to share your questions with Thierry and to answer them shortly. For those that do not know Technobis crystallization systems, although seeing some of the names that are joining us today, I do believe you know us quite well. Technobis crystallization systems is a Dutch company located in the north of the Netherlands, in Alkmaar. We are a world leading technology provider for solid state research, process development and optimization and formulation. We are in the business since 2005 with more than 600 systems already installed in the field and active in multiple industries, markets like pharmaceuticals, agrochemical, food, personal care, and of course in academia. Our product portfolio consists of 3 products: the Crystal 16, Crystal Breeder, and the Crystalline instruments. Some of you might know all of them. Some of you know most probably one of them. For those that they do not know these systems, are multiple reactor systems that in principle you can heat and cool in a controlled manner. They work at different volume scale, and they come with inline analytics. If after this webinar you would think that you would like to test one of these instruments, please contact us directly via the website, or send us an email at info@crystallizationsystems.com, and we can try to do a demo in your lab or share with you a bit more information about this instrument. The Crystal Breeder, just a little bit about the instrument. The Crystal Breeder, with its vapor diffusion setup and controlled evaporation, is, as I call it, the gadget instrument, which will help you grow single crystals and perform crystallization screens at early discovery when you have available a little bit of material. The crystalline with the camera technology that works really like a microscope, and the possibility to connect also a Raman spectrometer if you have in your lab, helps you to develop and or optimize your crystallization and formulation processes. And the Crystal 16 is your instrument for, remember, for solubility, metastable zone weight, and solid state screening. For some of you already know, the Crystal 16 was the third generation of the Crystal 16, was launched this year, a unibody crafted multiple reactor system that comes with 16 reactors, 4 block reactors that they can work in parallel at 1 milliliter scale. A temperature range for this version 3 of the Crystal 16 is the temperature range that you can now reach with dry air, so no chiller, with dry air, with all 4 block reactors in parallel, is minus 20 degrees up to 150 degrees. If before you were able to use to reach minus 10 degrees with only 1 block reactor, now you are able to reach minus 20 degrees with dry air once again, with all 4 block reactors in parallel. If there is the need of reaching lower temperatures like minus 25 degrees, this Crystal 16 V3, you can connect it to a chiller and you can reach even lower temperatures with all 4 block reactors in parallel. Another added value of this V3 related to the temperature accuracy is if before the accuracy was about 1-2 degrees, now we brought with this unibody crafted multiple reactor system the accuracy down to 0.5 degrees. Magnetic and overhead steering, turbidity, the transmissivity technology that some of you might know about it. This is also a big improvement. The technology is brought to a different upper level than before. So we were able, if we are now able to detect lower concentrations, for example, with carbamazepine, but of course is dependent on your system that you are using. I can give an example, the carbamazepine, if we were able at lower concentrations to detect about 1 milligram per milliliter, now we can go as low as 0.5 milligrams, the same per milliliter, the same also for the higher concentration. So your window of detection is enlarged considerably with this new version of the Crystal 16. Additionally, another development that we are very proud of it is the integrated software. The software is totally redesigned, intuitive, makes use of blocks that you can simply drag. I'm not very sure if you see my mouse, so you can actually drag these blocks, and in a very friendly, intuitive way, you can build up your program and make a profile to heat cool for your experiments. In the same time, you do not need any other software or piece of software for data analysis. So if some of the all users of the Crystal 16 know already about the Crystal Clear software, or you are used to use a different piece of software to analyze your data, now is not needed anymore. In the same software, you also have the analysis, which makes everything quite easy. You can fine-tune this analysis of your clear and cloud point in the same interface, so it gives you quite some flexibility, but in the same time takes automation to the next level. The same, another important feature that is bringing this new software is a standard way on how to perform induction time measurements. It takes you through this type of next level, let's say, experimentation in a very simplistic and easy way for more, also for advanced users, but also for those that they are not that at that high level of experimentation or usage of the Crystal 16. And with that said, I would like to go to our speaker today. And as I mentioned to you, this webinar is brought to you together with Veranova and Thierry. He will actually present 2 case studies today. Thierry has a background in organic chemistry, in organic synthesis and drug discovery, with over 25 years of experience in the pharmaceutical industry. He worked at the Neuroscience Center of Pfizer in 1999, and in 2000 he joined the combinatorial chemistry group of Medivir. I hope I pronounced it well, where he was involved in the synthesis of new enzyme inhibitors. He joined Pharmorphic solid form services business in 2007, and recently in June this year, this part of the business, which was known as the part of Johnson Matthey, is now Veranova. Thierry is their principal scientist at Veranova, leading internal and client R&D projects, including polymorphism and co-crystal studies, chiral separation. Additionally, he supports internal innovation, looking for opportunities to improve the offerings through application of new techniques or technologies. He is a co-author of a review on co-crystals, and he co-authored over 20 patent applications. So quite a lot of experience that Thierry is bringing today. And I will try now to give the floor to Thierry and start his first case study.
Hi, my name is Thierry Bonnaud. I'm a principal scientist at Veranova, and the talk I'm going to give you today is controlled crystallization and crystallization inhibition, standard and novel applications of the Crystal 16. Until May 2022, we were part of Johnson Matthey Health, and we are now Veranova, a new independent company owned by Altares Capital Partners. So Veranova is a leading global CDMO focused on specialty active pharmaceutical ingredient. With approximately 900 people, Veranova serves the pharmaceutical industry with a full spectrum of API and drug development services, from process design through to commercial manufacturing. We have a GMP manufacturing in the US and in the UK, and manufacturing an R&D center in Cambridge and in China. We are focusing on ADC linkers, high potent compounds, and controlled substances. Before we start, I would like to take a moment to introduce you to our solid form services. So we are based in the UK, in Cambridge, and our Pharmorphic services were established in 2003. We're helping globally mainly the biotech and pharma industry, but we are also supporting the agrochem industry. We have a long track record of delivery complex programs for our customers, and this is by applying our expertise to their challenge. So over the years, we have worked over 2,000 customer projects, which represent more than 600 compounds. And on site, we have 50 people, and our expertise is related to solid form and pre-formulation. So it's all about driving drug success and improving the properties of drug candidates. So over the years, we have worked on 2 blockbuster drugs and over 41 compounds which have been put on the market, including 10 in 2019, which represent 20% of the small molecules since 2014. We are working with a large number of companies, including 70% of the top pharma companies, and we are working in 1 of 3 compounds reaching the clinic. I'm going to give you an overview on how we are helping our customers. we are looking to enhance the performance of pharmaceutical through a number of support routes. It could be by Physchem analysis, screening and selection of the best solid form through a selection of a scale-up and crystallization development. We also provide early formulation and analytical development. That can give you access to robust IP position, and we are here to accelerate your development from particle to process to product. The first case study is going to cover a more conventional use of a crystal 16 in a crystallization, and we will explore the effect of seed crystal size in a cooling crystallization of a co-crystal. Innovation is one of the key components of what we do here at Veranova. After the acquisition of new tools, new techniques, and the adoption of new softwares, we like to revisit and improve current workflows. Today, I will show you how we have improved our control on crystallization and how we have an improved control on the final particle size. The model compound we have used for this study is a co-crystal of fungicide. After an initial solubility assessment of this material in class 2 and 3 solvents, we found out that IPA was the most suitable solvent system in respect to crystallinity, solid form control, and purity. Before walking you through a crystallization workflow, I want to introduce you to our model compound. So in this study, we use Perimethanol. So Perimethanol is a broad spectrum fungicide, and over the years, we've done a lot of salts and co-crystal with this compound, and we found that with 3-nitrobenzoic acid, depending on the condition we use, we can either form a salt or either form a co-crystal. So the challenge is actually to be able to control either the salt or either the co-crystal formation. And in this study, we wanted to look at the formation of a co-crystal. So in the next few slides, I will show you how we achieve a controlled crystallization of this form. As part of our process, we use the crystal 16 in a more traditional way to obtain solubility measurements. So we did prepare an IPA different concentration of our compound, and we generated the clear and the cloud points. And you can see the metastable zone width is around 10 degrees. We have high solubility at high temperature, low solubility at low temperature. The next thing we do is to use the software called Dynocam. So with Dynocam, we input all this data to generate a modified Van 't Hoff model. And that model has a very good fit with the experimental data, as you can see here. And for this process, you can see that we have access to a solubility of our compound in 10 volumes, and a 10 volume process followed by cooling can give access using the model to a physical yield of 95%. And if we want more control, what we can do is to add seed in the metastable zone. To get access to a controlled crystallization, the quality of the seeds is very important, as well as the loading of the seeds. And this is to allow the optimal surface area for growth. Last year, we acquired a jet mill. This is here pictured in a new isolator room. And this is to actually micronize the material. So we can generate very, very fine particles, and you can see this is the material before and after jet milling. So we obtain initially particles of 653 microns that could be reduced to 20 microns. And this large reduction of particle size is moving our sample from a plate to a block morphology. So in this slide, I'm going to describe how jet milling works. So the material is fed into a chamber where high pressure nitrogen jets cause collisions between particles, which fracture, giving a reduction in particle size. So this process is solvent-free. Milling operations are known to generate fine dust, an explosive hazard. So we operate in an isolator under a nitrogen atmosphere. And we have controls such as feed rate to the mill, grinding guide pressure to tune particle size further if needed. So the initial experiment we did was a crystallization with a milled material. And in our vessel, we did have two probes. The first one is from Blaze Matrix. So this probe is giving us an idea of how the particles will form. So you have a nice little window giving us a picture real time of what is forming in the vessel. And we have as well counts of different population of particles. So the large population increase over time, and the small population they decrease over time. We have a second probe from Mettler Toledo, which is an FTIR probe, and this is giving us an idea of the concentration of the API in solution. So over time, you can see that this is decreasing with cooling. So our acidic crystallization is done in 10 volumes of IPA. So we dissolve the material initially at 75 degrees. This is with a supersaturation of 1.14, and we add the milled seeds and we hold the temperature. So from the FTIR, you can see that we have a quick decrease of the supersaturation. And here you can see that we have actually stability during the whole time in terms of growth. And after that, we cool down the vessel to 5 degrees at 0.1 degree per minute. And you can see the increase of the large particles. And this is over time, reaching 5 degrees. You don't see more growth of the particles. And with the FTIR, we can see that as soon as we are reaching 5 degrees, we don't have any more desaturation to give us an idea of the kinetic. We get a very good yield, 93% yield. The co-crystal we have is phase pure. And after isolation, we can see by SEM these thin rectangle plates, which are quite uniform. So as a comparison, we did a second crystallization using exactly the same process as presented before, but this time we changed the quality of the seeds and decided not to mill the seeds, just to compare. After isolation, we looked at the particle size analysis of both batches. So in red here you see the batch which has been produced with unmilled seeds. We have larger particles, 600 microns, and a bimodal distribution. For the other controlled crystallization using milled seeds, we have monomodal distribution with a D90 of around 300 microns. So that's showing you that the quality of the seed can get you different particles at the end of your crystallization. Finally, we wanted to test the robustness of the crystallization procedures. So we did some repeats of experiments. So we did repeat the seeded crystallization using unmilled seeds. So in the second case, which is in green, we still have a bimodal distribution. However, the proportion of the small particles have changed, and in this case we have a D10 of 176 microns. When we did a repeat using the milled seeds, we have something which is nicely reproducible and a better controlled. So that's showing you that the quality of the seeds need to be consistent, and that's something we can achieve by using milled material as compared as using seeds coming from different batches. In this slide, I'm going to give you a summary of our crystallization workflow. So first, we looked at doing a solubility screen, and this is done on milligram scale, and this is followed by modeling. The solubility of our compound is modeled. That gives us an idea of which crystallization pathway we want to look at, and we select a crystallization system, which could be a cooling crystallization or an anti-solvent addition. Then we do investigation in gram quantities of the crystallization parameters, and we include the quality of the seed in a DOE. We use as well modeling and PIT tools to end up with a good crystallization procedure. And finally, we will do some robustness and reproducibility testing on a multi-gram quantity, and that can give us an idea of a good robust crystallization that we can therefore model further if we want to scale up on the kilo lab or production lab. I have one more slide on this presentation, and this is a video we did on the actual process we presented today. So we are going to give you a virtual tour of our lab in Cambridge. So this is a EasyMax. We are using our probes to monitor the crystallization. So after dissolution, we are seeding the material, and you can see the seeds. The seeds sustain, and we are cooling. We see formation of the particles. We leave the reaction to cool overnight. And at the end we filter. So we did the seeding with unmilled and milled material. And in both cases the filtration was very easy. Nice ideal filtration. And we did finally the full characterization we presented today. So the second study is a less conventional way in the use of the crystal-16, and the title is Screening of Crystallization Inhibitors of Uric Acid. So first of all, I'm going to give you some background on uric acid and hyperuricemia. So I put here the structure of uric acid, and this is a byproduct which can be found in the blood. It's a waste product of the metabolic breakdown of purines, and this is something which typically is in the blood plasma at higher concentration for males than females, and this is something we were interested to study. The elevated level of uric acid in the bloodstream is called hyperuricemia, and this can occur due to the increased production of uric acid or the decreased excretion of uric acid. And this is due to, as well, purine-rich diet, certain meats, and alcoholic beverages can aggravate this production of uric acid. After a certain level and concentration, you may have crystallization of this product into your joints and in connecting tissues. So that gives you gout, which obviously gives you severe pains in the joint and swelling, redness, difficulty in applying pressure on the joint. So this can as well induce a production of kidney stone, and that's touching around 8.3 million people, and this is mainly prevalent in male and aging population. There are two treatments which are widely available. One is using a drug called allopurinol, and this is to reduce the production of uric acid, and another compound called febuxostat, and this is a more potent and selective treatment. However, both compounds increase the risk of cardiovascular disease, which is not ideal for the target population for gout. So there is a need for alternative strategies to reduce the crystallization of uric acid and its sodium salt. In this paper, what they have done is they use different coformers to form co-crystals, and they compared the solubility of these co-crystals with the solubility of uric acid and the solubility of its sodium salt. So they found that aminopyridine is increasing the solubility quite well, especially after 2 hours. However, they were not so lucky with the other coformers, and with the 2-aminopyridine, they even reduce the solubility to a further extent. We found a second academic paper where this time the strategy was actually to inhibit the crystallization of uric acid. And this is done using theobromine, and they managed to delay the nucleation as well as changing the morphology of uric acid. So instead of having bigger particles, they managed to get smaller particles depending on the concentration of theobromide they used. So we were inspired by these two papers, and we thought that we could do an internal program just looking at crystallization inhibition and to check if the crystal-16 was a good way just to screen this kind of inhibitors, to demonstrate our capabilities to our customers and see if this could be applicable for very similar diseases. So we started looking at the inactive ingredients conformers, and we wanted to be able to actually have a robust way and a robust method for the crystal 16. So we looked as well, once we have identified some hits, what sort of equivalent will be effective, and if we had any further delayed nucleation, we would scale up some of these corresponding salts or co-crystals and get a full characterization with all the equipment we have in-house, including looking at the solubility of a prepared salt at 37 degrees, understand the properties of these salts, and compare these salts with uric acid. So initially, we use the crystal 16 as a more traditional tool to get the solubility curve of uric acid in water, and this is the curve in red here. We could get the solubility as 0.29 mg per ml at 37 by extrapolating the temperature in the curve. And from that, we set up an experiment to look at the nucleation time with a given supersaturation. And we compare this experiment with other experiments where we use the addition of the conformer to see if we could delay the nucleation time. So in this slide, I'm going to present you the procedure we use to screen our conditions. So initially we prepare some uric acid concentration in water up to 1.6 mg per ml, and we apply the following program. So we stir our samples, and we started warming up the sample between 20 and 90 degrees. We hold the temperature, and at this stage we're trying to obtain a clear point with 100% transmissibility. Then we fast cool to 37, and we hold it at this temperature for 12 hours. And at this stage, we're trying to assess if we have a cloud point, and if it's the case, we have crystallization of uric acid. So what we found is for concentration below 0.10 mg per ml, we could not see any distinguishable cloud points. For suspension above 0.81 mg per ml, we could not get any dissolution, and that's not something we could evaluate. So at the end, we decided that we would screen at 0.5 mg per ml and trying to get supersaturation and evaluate the nucleation time at 37 degrees and the effect of a conformer. So this is an example of a program we use with the crystal 16. So we start with a suspension of 0.45 mg per ml of uric acid in water, and this is something we dissolve, and we can see soluble material at 74 degrees. So after that, we apply a cooling ramp to get a supersaturation ratio of 2, and we see nucleation at 40 degrees. So this is the program we use for pure uric acid, and we repeated this with a 1-to-1 addition of conformers. So we screen in total 49 different conformers. So this is the list here. So we have a selection of carboxylic acids, a selection of amines, amino acids, and some neutral molecules like caffeine and urea. So out of all these conformers, 16 showed a delay in nucleation, and 12 have a significant delay in nucleation, more than 2 hours. And this is what I'm going to show you in the next slide. In this slide, we focused more on the 12 hits we have. So we changed slightly the program on the Crystal 16. And this time, what we do is a hold time up to 60 hours instead of the 12 hours we had before. And with pure uric acid as a blank, we can see very early nucleation. We have a group of compound which is circled here, where at the end of the program we did not have any nucleation. That nucleation happened on the cooling ramp from 37 to 5 degrees. So in this series of compound we have some amines, and as part of these amine groups we have some material which are accepted in the IIG list, some which are in the GRAS list, and some which are showing some known issues of concern in terms of safety and toxicity. In the previous slide, we were showing you the effect of the nucleation with one equivalent of coformer, and with the best coformers we have, we decided to go down, adding less equivalents of coformer and to see the effect. So if we go down with two less amount of coformer, we don't see any difference with what we observe with a blank. However, with 0.5 equivalents, we can see that with a group of amines, we still have no nucleation at all, and in one case, we don't see any nucleation at all with 0.25 equivalents. Next, we wanted to get solubility data on the corresponding salts of the amine hits we identify. So we set up a salt screen using uric acid on a 50 milligram scale in a variety of organic solvents. The challenge was the poor solubility of uric acid. So we did stir the suspension up to 3 days before we took an aliquot for XRPD analysis. And we identify new solid form phases by XRPD, and we assume at this stage that we had a salt formation, and we scale up to 750 milligrams some of these salts. So we did manage to get conversion to the salt for some of the amines, but not all. And for some salt, we could see polymorphism. At the end, we had 3 different crystalline salts that we fully characterize, including the solubility using the Crystal 16. So this is more details on the scale-up and characterization of the salts. So we did scale up the bromethamine salts, the triethylamine salt, and the ethanolamine salt. So we had extended stirring for 6 to 7 days. And in all cases, we ended up with a crystalline powder that we characterized by XRPD. And we did additional thermal analysis, such as the DSC to get an idea of the endotherms, and the GGA to see if we could have any detection of solvent associated with a weight loss, or have an idea of the degradation. We finally characterize the salts by NMR, and we could see that we have the CH peak from the amine observed by NMR. Finally, we looked at the solubility of the characterized salts in water, and we used the crystal 16, and we compare this data with uric acid. So after drawing the curve, we extrapolated the solubility to get the value at 37 degrees, and we found the best solubility were with bromethamine salt and ethanolamine salts. This is a summary of what we did. So initially, we looked at the delay crystallization of uric acid, and this is using a list of coformers. So in this table, you have the list of the best coformers we found to delay nucleation, and we studied that with one equivalent, and we looked at less equivalent as well. We then went to scale up some of the corresponding salt. We were less successful. I think it was fairly tricky to dissolve uric acid and form the salts. However, after characterization and scaling up, we found that we have good improved solubility with bromethanine and ethanolamine salts. So at the end of our study, we went back and looked at the patent literature. We found a very interesting patent application coming from China, which is using actually bromethanine in vivo studies. So in these studies, they did induce gout symptoms in mice and rabbits, and they looked at the effect of treating this population with sodium bicarbonate and bromethanine. So interestingly, in the rabbit study, they looked at the increased kidney swelling, and as you can see, we have a small reduction when they are using sodium bicarbonate, and even a further reduction when we are using bromethanine. More interestingly, they looked at the uric acid crystallization and the kidney stones. With bicarbonate, they can see a reduction. However, when they are using bromethanine, they don't see any uric acid crystals or stones. So we were pleased to verify that our findings in the literature support in-house research, demonstrating that the crystal 16 can be used to accurately investigate and identify crystallization inhibitors for disease like gout. So we have some conclusions for these second studies. So as a summary, we looked and we identified 12 coformers that delay nucleation of uric acid, and that was at least by 15 hours. We went and we extended the crystal 16 program up to 16 hours, and at this stage 7 coformers were still delaying nucleation up to that time. We then scale up, and we only succeeded scaling up 3 of these salts, of the corresponding salts, and 2 actually were prepared and show much more solubility than uric acid. So these 2 are the bromethanine salt, which is around 5 times more soluble than uric acid, and ethanolamine, which is 17 times more soluble than uric acid. We finally find out from the literature that bromethanine has been reported as an effect inhibitor for the crystallization of uric acid in vivo studies, and that would be very interesting to see if ethanolamine could produce the same result in vivo. So to conclude, I have a summary slide presenting the 2 case studies we did. The first one was a coding crystallization of a co-crystal. represented the workflow and the use of the Crystal 16 as part of this workflow. We shown you as well how we introduced jet milling to control the size of the crystal seeds. So small crystal size was achieved in comparison with uncontrolled batches of seeds, and we showed you the benefit of seed control. We had a second case study, and this time we show that the Crystal 16 was a valuable tool in the search of crystallization inhibitor of uric acid. So we use the Crystal 16 in a non-conventional way to find inhibitors of uric acid, and we found that methanine and ethanolamine were the best hits. I would like to thank a number of people who contributed to these studies. So for the crystallization study, Ruth, Dan, Osama, Emma, Zoe, Jeffro, and Richard, who did a fantastic work characterizing this co-crystal and trying to get a very nice process. So all this work was completed very recently in May 2022. And finally, Francesca, who did all the work on uric acid. And all the members of the Cambridge team, members of the present and the past teams.
Thank you, Thierry. I hope you all can hear me loud and clear. I did not manage to get Thierry online on the GoToWebinar platform, but I have him on a different platform, and hopefully my colleagues can confirm to me that we hear each other.
Yes, we do.
Yes, perfect. Thierry, we have a few questions we have received. I will try to read them now to you, and hopefully you can, our attendees can hear you. One of the first actually questions that I had for you was is related to a bit to the Crystal 16, and I wonder that you have used quite a lot the Crystal 16 in well, your team in the studies. How would have been this study without the Crystal 16? I'm going to a more let's say
Yes, I would say I think in the past we would have used a probe, which obviously will be put in a aisle, and I think these probes we used to get a lot from these maybe 15 years ago. However, it's just the scale. You need maybe like 5 mL of solvent, so we could do at the time 4 in parallel, and now we are much quicker to generate data. So we would have done it, but it would have taken much more time than with the Crystal 16.
Yeah. Thank you for that, Thierry. I do have a few more other questions. I will read them to you. What was the criteria you have used to select those inhibitors?
So we looked at different lists, and one of the lists we used is the GRASS list, which is something which is being published on the FDA website. But we came across another list, which is the inactive ingredient list, which is all about the inactive excipients that are currently on the market for the drug. And from that list, there is about 4,000 entries. We looked at something which looks like a small molecule, which could potentially interact as, you know, we've got a proton with uric acid. So if we have some groups which are obviously able to exchange a proton to form a salt, or at least interact to form a co-crystal, we would have selected these as a potential inhibitor.
Okay, thank you. Do you use dry seeding or wet seeding?
I think it's really depending on the scale. So if we do small scale experiments, we would start with what we have, which are dry seeds. As we are moving up in scale, let's say that we are going to do a kilolab campaign. That's something we want to investigate. So that's easier to apply that to your reactor. Otherwise, you may have the seed stuck in your line. So, you know, having a sort of wet slurry you prepare before will be easier to apply on a large scale. On a small scale, we will just take a tip of a spatula just to look at the influence of the seeds. So really depending on the scale. And there is different ways to do that on kilolab scale. You can do a suspension and you know you can put a pressurized vessel where you could expel the slurry with the seeds. That's quite convenient to do.
Okay, thank you. Another question is related to the co-formers. Do we have to give co-former as drug? I guess the question is related if the co-former has also activity or so. What do you think about that?
So in terms of co-formers, I think the preferred choice would be not to have any activities. However, you know, depending on the drug, if a co-former has some activity which obviously show low toxicity and maybe still compatible with the disease, I would say that's something to consider. You know, I think if you look at recent co-crystals, you know, you have a couple of drugs where actually the co-former is another active, and in this case, I think there is a synergy of the two active together. But you need, if you use an active, to be very aware of the benefit of this active, or you need something which give a benefit, and you need to demonstrate that.
We have a question related to the question before, related to the dry-wet seeding. David has written again. I think, do you see the difference in dry and wet seeding?
I would say that's something to evaluate as part of a study. The wet seeding, you may get better dispersion in your vessel because obviously everything is wetted. You know, the particles they will be nicely flowing. So I think it's really compound dependent. Yeah. But typically, if you prepare your wet seeds, it takes a bit longer. But you may have added benefit because you're sure that your seed will be dispersed much quicker than if you add solids, especially on the big reactor.
Thank you. And we have another question related, I think this is related to the Crystal 16. One of our attendees is asking if he would like to understand which method for ramping, so I guess the linear or the quadratic, which is more precise. I don't think the ramp is related to precision, is more the technology related to precision. I think it's related more to the objective that you have, right?
Yeah, that's right. So, I mean, typically, we will take a linear ramping because, you know, we can control it better than, and it's nicely reproducible. However, I would say sometimes more than the shape of the curve, it's more the heating rate, which is important, especially if the dissolution is slow. So we do a first evaluation with our compound at, let's say, 0.5. But if we think that we want reproducibility, we will double check with a slow heating ramp to see if it's making any difference.
Yeah, and indeed, what I would like to add to this is usually with the Crystal 16, it's more often that our customers and also us, we use more of a linear ramp, and the quadratic ramp is more for a larger scale. For the crystalline, where you really look into the optimization of the process, not only determining the solubility and so you already have a system that you are exploring it and you know much more about it. So just to try to get you even a bit closer what happens at the larger scale to the next step and so on. We have another one. Do you sieve the seeds, either milled or not milled? If yes, what sieve fraction size did you use? Oh, I think you mentioned this already.
Yes, so we used, in terms of size, seeds which are typically what we get from the mill. And in terms of milling, we tend to get seeds between 5 and 10 microns. So that's the typical seeds we get. So in terms of seeding, the more seeds you have, the better it is. So, you know, the smaller the seeds are, the more seeds you will have in your vessel, and that will take more of the supersaturation than if you don't seeds. I think there was maybe another part in your question, but I didn't get that.
Yes, yeah. I think this is it. We do have a few more, but I also look at the time, so we went a bit longer over the time. Thank you very much once again, Thierry, for bringing these two case studies to our attendees today. Thank you all for joining this webinar. Please stay tuned. 28th of July, we come with another webinar. That time we will bring to you more case studies related to crystallization and small scale single crystal growth with Professor Bernard Spindler from Zurich University and Professor Doris Brown from Innsbruck University. You will receive soon some information from us. Once again, Thierry, thank you very much. Thank you all for attending. Have a good morning, afternoon, or evening, wherever you are. Bye.
Bye-bye.
Okay, I think I ended the webinar.